introducing Daisy Ilchovska, who graduated in 2020 and is currently running her own clinic, Optimal Health Nutrition, and working for the London Clinic of Nutrition. Daisy specialises in working with clients with autoimmune disease, mycotoxin or mold illness, as well as Lyme disease. In May, Daisy published her book, Lyme in the Limelight, which investigates the link between Lyme disease and numerous autoimmune conditions, including brain autoimmune conditions such as MS and Parkinson's. Daisy has also contributed a chapter on Lyme disease and autoimmunity to the 3rd edition of Infection and Autoimmunity textbook, published by Elsevier and due out in February 2023. So today, Daisy's presentation is on an overview of the NF-kB mechanism of pathophysiology in rheumatoid arthritis, investigation of the NF-kB ligand, rank L, and related nutritional interventions. So welcome, Daisy.
Thank you so much for having me here today. I'm very pleased to be part of the 21st anniversary conference and present my published research. It's on a topic that I'm really passionate about. Rheumatoid arthritis was the reason why I requalified as a nutritional therapist. And I now have the pleasure of working with many people with rheumatoid arthritis. Thank you so much for the kind introduction, Indrani, as well. So as you mentioned, I'll be presenting my research, which is an overview of the nuclear factor kappa beta mechanism of pathophysiology of rheumatoid arthritis, investigation of the nuclear factor kappa beta ligand RANKL, and related nutritional interventions. So it was a systematic review study which incorporated review studies, animal and in vitro studies, and intervention studies of some individuals with rheumatoid arthritis. I think the intervention studies were about 36%. The main mechanism was this ligand of the main inflammatory pathway, which is the nuclear factor kappa beta, and the ligand RANKL, which is more concerned with bone erosion and inflammation. And the actual interventions which came through were the effect on vitamin D, which has got more of a synergistic effect on this ligand, as well as related cytokines. So in terms of mechanistic reviews, that was a review of this main inflammatory pathway, nuclear factor kappa beta and RANKL. And outcomes was an overview of these pathways. The RANKL pathway is the much less studied pathway and new target pathway for many pharmaceuticals these days. And other important concepts came through, such as the role of some cytokines, such as IL-6, Th17, and other pathways such as the STAT3 pathway. So the scope of the research was the systematic analysis of these two main pathways, with particular focus on the RANKL pathway, and systematic literature search and analysis of evidence of the action of natural compounds and nutritional interventions on that particular mechanism. Obviously, the broader context is nutritional interventions and personalized nutrition in the management of rheumatoid arthritis. A bit more about rheumatoid arthritis. It's a chronic inflammatory autoimmune disease which can cause severe inflammation, joint damage, and in some cases can lead to disability. It is one of the more common autoimmune diseases, up there with Hashimoto's, and there has been a growing incidence in Western populations. With regards to root causes and triggers, we are aware of some, but there isn't a particular single root cause that has been linked to this particular autoimmune disease. There is some research that suggests that infections such as Helicobacter pylori can trigger the immune system and lead to the initiation of rheumatoid arthritis via a very, very well studied mechanism called molecular mimicry, which is the case of mistaken identity in inverted commas by the immune system. And interestingly, as Indrani mentioned, I have been studied for my book, Lyme in the Limelight, the role of this molecular mimicry and the onset of numerous autoimmune diseases when it comes to the Borrelia burgdorferi bacteria or the Lyme disease bacteria. The issue is with this main inflammatory pathway, the nuclear factor kappa beta pathway, is that it not only regulates the inflammatory response, which leads to disease initiation and continuous inflammation, but it also has a homeostatic function. So there is a real issue with non-discriminative suppressing of this particular pathway. And that's why a lot of research in the more recent decades has been focusing on this particular ligand, RANKL, which is linked to bone degradation, which is one of the main features of this disease. And many researchers are calling for RANKL to be the main therapeutic target. And whilst we know there is a lot of research in terms of compounds and vitamins and things that act on the nuclear factor kappa beta, such as omega-3 and curcumin. There was, well, at least 2 years ago, there was not a lot of evidence in terms of some of these nutritional interventions acting on this RANKL ligand related to bone degradation. So the main mechanisms explained in this research, again, are nuclear factor kappa beta and this RANKL mechanism responsible for osteoclast and osteoblast bone erosion. And apologies for the fuzzy picture here, but you can see here how some of the activated T cells of the immune system trigger this RANKL mechanism and the production of osteoclast and osteoblast cells, which relate to bone erosion. So in addition to that, when I started looking into some of these mechanisms, it was quite clear from the literature then, in addition to issues with non-discriminative suppression of the nuclear factor kappa beta pathway, there are some other issues, such as corticosteroid resistance in about 30% of individuals with RA. So this is about basically a third of the people that were giving corticosteroids to act on this nuclear factor kappa beta were actually resistant. So there was a real need to discover interventions for these different pathways. One of them being this RANKL pathway, which I was looking at. And there was quite a few cytokines that, or inflammatory messengers that were associated with this main pathway, the main ones being IL-6, TNF-alpha, IL-1B, and this particular STAT3 pathway. It turned out that it's quite important to have this particular ratio being measured. So this is the actual ratio between bone degradation and bone reabsorption, called OPG, RANKL ratio. The higher that ratio, the more favorable that outcome in terms of bone degradation in rheumatoid arthritis. So this is, I'm not sure how clearly you can see this, but this is the actual mechanism that I was looking at, the difference between osteoblasts and osteoclasts. Here you can see the activated T cells, the different cytokines. Here you can see the RANKL mechanism. I'm just showing you this because one of my suggestions for future research is to actually focus a bit more narrowly on some of these in relation to nutritional interventions. I do feel, reflecting back on that research, that perhaps the scope was a bit too wide. So when it comes to interventions, so vitamin D in conjunction with calcium interventions actually increase the OPG-RANKL ratio, which is the more favorable outcome. When it comes to bone degradation, vitamin D slightly increased the OPG levels again, which is linked to more favorable outcomes. It had some effect on lowering some of these inflammatory cytokines such as IL-17, and had a positive effect in increasing T regulatory cells of the immune system. However, there were some issues in terms of the quality of the intervention studies. The doses of vitamin D being used were not very clear. In some studies, there were doses of 400 IU being used daily, and some studies that used up to 30,000 IU weekly in injections. None of the studies considered some medication interactions, and it is a well-known fact that corticosteroids deplete vitamin D levels, for example, and corticosteroids, despite the steroid resistance, are one of the most commonly used medications in the management of rheumatoid arthritis. There was no control for things like diet and sun exposure, most importantly, the times of year the studies were actually done. So I would say the overall quality of the intervention studies in terms of controlling for some of these things was poor. In terms of clinical application, I think vitamin D is a relatively straightforward nutrient that can be easily used. I think it's important also that the general public has got really, really good awareness of vitamin D levels and the importance for overall health. I was reflecting that when I was first diagnosed with rheumatoid arthritis 12 years ago, rheumatologists rarely talk to patients about vitamin D levels, and now most of my rheumatoid arthritis clients talk about how their rheumatologists prescribe vitamin D and monitor their levels regularly. I think there needs to be more clarity on safe upper doses of vitamin D intake. I don't think there is a clarity in the literature about sort of upper limit intake, and that certainly varied in some of the interventions. As I said, with sometimes really high doses being used once weekly. It will be also really interesting to consider, co-inserting or using vitamin D with other more synergistic vitamins, such as K2, which can enhance absorption and bioavailability, and other nutrients such as magnesium. In terms of future research, as I mentioned earlier, I feel that my mechanistic review perhaps was too broad, and it would be really interesting to focus more deeply on some of these other concepts that closely link to RANKL, such as the OPG and RANKL ratio, or perhaps some of these more isolated cytokines, such as IL-6. So a more narrow focus on some of these being studied in relation to nutritional interventions. And when it comes to intervention studies, again, addressing some of these issues mentioned previously, having a large sample of people where, another thing, major thing, which I couldn't quite believe when I was reading some of these intervention studies is that baseline vitamin D levels were not measured. So, you know, having a bit more strict criteria about baseline vitamin D levels, interactions with medications, sun exposure and things like that, that would be really, really interesting. And the major issue of, I think most of the studies, I can't remember now whether they were done on mixed populations of men and women, that it will be really interesting to look at the gender differences as well and consider those. So that's me. I hope you found this interesting.